Welcome to Chamber Exchange, a TV show. My name is Tim Murray, President and CEO of the Worcester Regional Chamber of Commerce. And Chamber Exchange, a TV show, is an opportunity for us to have on our chamber members and guests to talk about issues of business, economic development, and various needs and issues in the community and region. The show happens because of our sponsors, St. Vincent Hospital and Bank Hometown. I want to thank both of them for sponsoring the show. We're going to kick off in our first segment with Ray Marsh, who's a treatment advocate from Recovery Centers of America. Ray, welcome.
Thanks for having me, Tim.
Well, Ray, the fact of the matter is, there's no individual or family or business or organization that somehow doesn't have a touch point or an understanding of kind of the impacts of issues around addiction. And more importantly, with that is making sure that people understand that there are pathways for help and recovery. And that's really, what your work's all about.
Yeah, absolutely.
So if we could, Recovery Centers of America, you're located in Westminster?
That's correct. We have two facilities in Massachusetts, one in Westminster and then one in Danvers, Mass. as well. Okay,
and those facilities, I assume, you have inpatient facilities and then outpatient programs in terms of how you might work with individuals battling with addiction.
Yeah, absolutely. It's a full continuum of care. So we have inpatient treatment. We're really a 30-day program. So we do inpatient medical detox and then inpatient residential rehabilitation, which would equal that 30-day program. So we don't have a separate detox or a separate residential like most of the facilities in Massachusetts have, which is pretty unique. We saw longer lengths of stay from the patients and then less leaves against advice with that model. And then also we find that having the same care team is super helpful. One case manager, they meet their therapist earlier, and then they're also assigned a recovery counselor as well.
Right. So if someone, we'll take a step back for a second. If there's, an individual out there who recognizes that they need, some steps to take help, if there's a family member who wants to help, get that information, they would contact you, and that individual presents, evaluated. Just can you maybe walk someone through the process who may call and say, look, I need help, help, but don't know what help they need?
Yeah, absolutely. And most people don't, right? And my job's just to educate the family member or the provider that we're working with. One of the other programs we do is called our Fast Track ED program. So working with our local hospital partners like St. Vincent's and UMass with freeing up an ER bed as quickly as possible if the detox can be done at our facility. So usually we can have them out of the ED within about 90 minutes, which is pretty unique.
We're ED being emergency department.
That's correct. Right, yeah, exactly.
At the hospital.
Yeah. And a lot of times too, we're also talking with a family member that the person doesn't want to go to treatment, and we have family support services and intervention services as part of our admission process, so that if an intervention's needed, we can get them right with the intervention team, deploy the interventionist, and help get the person to consent into treatment. A lot of times they don't know which drugs or alcohol means detox and what means residential, but I can help them get in the right level of care and make sure they have the right inpatient experience. If it's something where it's an outpatient level of care that they're looking for, we also offer that as well. So full day partial hospitalization, which is a full day program from 9:30 to 3:30, and then we also offer half day intensive outpatient both in the daytime and the evening time as well.
Right. And in some cases it may be a little bit of both, right? You might have somebody who enters the inpatient, which I assume is more intensive, 24/7 kind of presence, kind of working on physically and mentally, kind of stabilizing things and kind of focusing on steps towards recovery. But oftentimes after people might complete that 30-day, they might kind of go on to transition into outpatient care.
That's correct. National Institute of Drug Abuse says that 90 days of formal treatment is needed for to make the most effective means to access recovery, so that 90 days would span that inpatient and outpatient treatment that we had talked about before. We also try to work with other companies with their human resource and employee assistance programs as well, because sometimes they need help there, and we try to help them access their FMLA and paid leave through the state, and make sure that it's not a barrier. Like in my own experience, in my own recovery, I found out I had an employee assistance program after it was a problem, and didn't know what it meant or how to utilize it, and they weren't the people that actually got me to the substance use treatment. Those benefits are kind of hidden, and we're trying to make more employers out there what we call recovery ready, and making sure that the substance use benefits are also accessible. A lot of times they're referred back to their insurance to get a list, and lists are not helpful from either the hospital or from the insurance company, because it places a barrier up to people accessing treatment. Utilizing a treatment advisor like myself really breaks down that barrier. Right. They call me, and then we run their benefits within about 5 minutes. We get them on the phone to do a pre-screen with my team. And then we usually have the car to them within an hour to get them into the facility. So it's a quick, seamless process. And then we're calling that family member or loved one within 72 hours of them admitting to our facility. Hey, your loved one is here and they're okay, and start to involve them in the treatment process as well.
Right. So you raise a good point. I mean, people who have health insurance, through their employment is one way, and what I hear you saying is it's really important. And oftentimes people don't, right? They think of health insurance if, they have an emergency and or their regular doctor's visit, but oftentimes most plans have some level of coverage for this type of thing. But it's making sure they understand that, someone making sure that how they can fully utilize all aspects of it, and that's what you're hoping to do with employers, because they're paying for this, for the well-being of their employees. The employees are oftentimes paying something in, so again, it's making sure that they understand the full range of services that may be able to help pay for this treatment.
Yeah, absolutely. And I think too, there's the in-network and out-of-network thing with an insurance, and a lot of people don't understand what that is or what that means. But we're in network with 99% of the insurances that employers have, and knowing that you're going to pay the in-network deductible and the in-network what's on your in-network policy, but really educating people that if they have out-of-network benefits and the additional costs that can be, so that they don't get this huge bill at the end because they went to an out-of-network facility when they could have came to an in-network facility like ours.
Right, and you also can work with individuals who may have some ability to pay themselves.
Yeah, absolutely. We do have comfortable self-pay options, and we have patient financial services that actually will get on the phone and craft a comfortable payment plan, no interest, that we can spread out over multiple years as well.
Right. And so, we talked about you talked about the 90 days really kind of being important to ensure kind of a successful recovery. But big piece of this also, and part of your program, is kind of a network that goes beyond the 90 days and providing those ongoing supports as well.
Yeah, absolutely. So we have our alumni program. So when somebody leaves the formal treatment with RCA, we connect them with an alumni support team member, and that person helps them get connected to the general recovery community. So not all the time do people enter through a 12-step fellowship for their recovery. They might find a different pathway, and the alumni program helps them access those different pathways. We have a regular alumni meeting that is hybrid at the facility on Wednesday nights. And then they get regular engagement from our alumni coordinator. We have one at each facility that they're able to connect with regularly. And if they do have a slip up, they can say, hey, I slipped up and I need a bed. Can I come back in? It's another access point to re-accessing treatment.
Right. And so, Ray, if someone's interested in learning more about the Recovery Centers of America, the services you provide, what's the best way that they can find out or contact you?
Yeah, absolutely. It's call me directly at 774-708-9313. I am on that phone 24/7, and you can call that phone instead of calling the 800 number that way. And then we also work with first responders and crisis healthcare workers too. That's a special program that we have at our Westminster facility. So if you are in any of those roles, knowing that there's a focused program at Westminster for you there as well.
Great, great. Well, Ray Marsh, treatment advocate from Recovery Centers of America, doing a lot of great work and getting the word out there. So thanks for being with us.
Thank you so much.
Good.
Yeah.
We're going to come right back for our next segment of Chamber Exchange, the TV show.
These days, you've got your hands full in life. That's why we help you bank simply and securely with tools like Face ID and Touch ID. It's why we make it easy to make purchases on the go and get cash back while you're at it. Why we help you quickly deposit checks wherever you are. And it's why we lend a hand with sending and receiving money right from your phone. So even when you're on the move, you can manage your finances. Bank Hometown. Unlock your potential.